Hey, Dr. Tam here. What I like to do is show you what the knee really is, because when you have knee pain, looking at this picture right here, well, overall, when this picture on the left is a damaged knee, what actually happens when your knee is damaged overall is you start to have necrosis, avascular necrosis of the knee. The knee becomes arthritic. There's breakdown of the knee joint itself. And when the knee joint breaks down, what happens is the cartilage on the inside, the ligaments, the muscle attachment, it starts to tear up. And when you feel pain, see, arthritis doesn't always cause pain, but how your body feels pain is through the nervous system. When there's an area in your body that has affected the nerves, now the body is saying, hey, there's pain. Because until something affects your nerves, your body won't actually feel pain. Think about it. For me, I've had patients over the last 10 years who've had massive arthritis that have a little bit of pain, and some that have little bit of arthritis and have a major part of pain. What it comes down to is, has the arthritis affected your nervous system and now affected or pinch or compress or cause a problem in your nerve to now cause pain? See, knee problem happens in 1 out of 4 people in the US. 300 million people here in the US. That means knee problems affects almost 80 million people. Now, most times, knee problems don't just correct themselves by itself, especially if you're over 60. Your healing capability is a lot lower than someone who's in their 20s or 30s. And what happens is now, it starts to limit your activities in life, your travels, all the things that you love to do to have fun, maybe with your friends, swimming, biking, walking. It's gonna affect everything. And quite frankly, last week, one of the patients told me, Dr. Tam, the worst thing for knee pain is gardening, because you have to get up and down all the time. And there's no way I'm able to get up and down 10, 20 times per session without sitting down. Or another chef told me she has to stand all day. She cooks on the weekends, and it's maybe not even the professional chefs. I thought about, what about all the moms and grandmothers that have to take care of their family? That is detrimental enough, let alone a professional chef. But what it comes down to is, when you look at the knee joint, right in this area is the knee starts to break down. Most of the time when I see knee problems, it starts to break down either on the inside of the knee or the outside of the knee. There are times, a majority of the time, in ladies that it breaks down more on the inside of the knee due to the amount of Q angles that ladies have. And now they call it a valgus, okay, stress. Valgus meaning the knee going and pointing towards the inside, whereas varus means the knee pointing towards the outside. And what happens is, it starts to wear and tear on that joint. See, some things that we do in our office is, number one, well, when you see a needle in here, what happens is when the stem cell itself is injected into that joint, it starts to fill up the whole joint capsule and space and start repairing the damaged blood vessels, the damaged muscles, the ligaments, by having growth factors in there, cytokines, enzymes, stem cell products, really to help that knee regrow and help repair the knee with musculature, ligaments, blood vessels, even cartilage, okay? A lot of people say, well, Dr. Tam, I thought once cartilage is gone, it's gone, you can't get it back. Well, that is the case if you don't have enough stem cells in your body to help your body repair itself. Are there proofs of it? This was done by the ABC news station in Utah, where they took an x-ray of a patient after receiving stem cell therapy, regenerative medicine, and look at their knee. This is the before, 3 months before, where the knee is practically bone on bone, to 3 months after, and you see that gap here. So it's not something that is unknown. News reports are showing it now, and it's very prevalent, used as one of the most widely used regenerative medicine methods in the history of regenerative medicine. Stem cell therapy is one of the most widely used regenerative medicine therapies today because it's the cutting edge Doctors and patients are now looking for ways to actually regenerate joints and help patients without surgery, without the harmful steroid shots and medication necessarily. Some patients ask me, well, Dr. Tam, what do stem cells do? Well, stem cells, number one, in the body can replicate. It's able to turn and feed off of nerve cells, liver cells, heart cells, blood cells, on top of muscle and ligament cells. See, within stem cells is something called the Wharton's jelly and also the matrix, where there's cytokines, over 100 different growth factors that's in there, hyaluronic acid. So it's not just stem cell itself, there's a lot of other growth factors and products inside the stem cell. When it's injected into a joint that is damaged, it can really help that area. What I like to do is invite you to our regenerative medicine and stem cell seminar, where you really get to learn a lot more about what stem cells and regenerative medicine has to do with your body today. How can you live a life that you really never thought you could have? There's testimonials of patients having their knee pain stop burning. They're able to walk again without pain, maybe even skip out on surgery if they can, because their pain has gotten that much better. And I'd love to share that information with you at our next seminar. Have a great day.